The role of physical therapy is to provide our patients with post-op care after surgery, if they have an injury, to provide strength training exercises.
The direct access physical therapy workflow allows our patients to make appropriate physical therapy visits without needing to contact their PCM team.
So they're able to come in now and have walk-in hours where they can walk into physical therapy and get seen.
That direct access is very important for active duty because, especially if it has to do with like a PT test, if something happens, then we can get them seen immediately as opposed to having them wait. This is something that's really important with our active duty population because there's a big focus on us staying physically fit.
It's a benefit to the patient to have the physical therapy direct access so that they're not wasting their time with a visit that they don't necessarily need with their PCM.
Because that might take a little time to see the doc. So they come directly to us and we can get things started right away and hopefully get them back to duty.
That's important because fit to fight basically is it's what we do every day, we have to be in shape, we have to be ready.
I believe that this open access policy is going to greatly benefit the patients and also increase the efficiency of the PCM team.
The direct access physical therapy workflow is a benefit to the PCM teams because we don't have wasted visits for issues that could be easily addressed without being seen.
Offering direct access to physical therapy is an important part of providing efficient and effective care for active duty patients. Physical therapists who are part of the Enhanced Access team have the ability to evaluate and treat patients without a referral, prescribe medications, order diagnostic imaging and lab studies, place patients on quarters and profiles per service policy, refer patients to other practitioners, and return patients to duty when indicated. Physical therapists coordinate care with the PCMH team as necessary. An episode of care for direct access PT patients will normally last 30 days. If the patient is not making satisfactory progress after 30 days, they should be referred by the physical therapist for further specialty care in coordination with the primary care manager or seen by the PCM as appropriate. Direct access care may be provided within the PCMH clinic when space, manning, and patient flow make care more efficient.
Our physical therapy group serves our unit by helping rehabilitate our active duty population after injuries or surgery or any other type of musculoskeletal issue.
So our active duty members do have direct access to the physical therapy clinic. If they have a new injury or something that's been bothering them,
They can teach you how to step correctly, they can help work on your running.
We try and get people in pretty quick when there's an injury because if we can avoid surgery, then that's what everybody wants. Nobody wants to go to surgery. And it gets them back into duty quicker as well.
And then they also help rehab people after surgeries. If you have a major knee surgery, they have those services they can provide.
And then another way that they help us is if we see that there's a certain disability that comes in the door, they have walk-in hours so that we don't have to use one of our appointments. If it's something that we recognize that our physical therapy team can help with, we can refer them for the walk-in hours.
And for that reason, our physical therapy staff are instrumental in us being able to deliver quality care.
And they actually do very well, because I've utilized them before as well, to help you rehab, get you back to 100% where you need to be, where you should be, and that's part of that world-class healthcare that we provide.
Any active duty patient with a new onset musculoskeletal complaint, including shoulder, arm, hand, hip, leg, foot, back, or neck, can contact the appointment line for care. If the criteria for direct access is met, the patient is booked for an acute or 24-hour appointment with physical therapy. The physical therapist conducts a detailed, comprehensive medical screening and differential diagnostic process to ensure that the patient meets the criteria for direct access care. The physical therapist can then design an appropriate treatment and follow-up plan the same way they would for a patient referred by the PCM. Care coordination with the PCMH team should also work the same as it would for referred patients. Procedure, or PROC appointments, and follow-up, or FTR appointments, should follow the same processes as 24-hour appointments. The physical therapist may discharge the patient from direct access care with the appropriate documented instructions for return.
We have an active duty patient on the schedule with lower back pain. There's a note that says he hurt his back lifting some boxes a couple days ago. Should we go ahead and book him with PT?
Yeah, good idea. And don't forget to mention that in the huddle.
Definitely, ma'am. I'll call the patient and explain the appointment change. And I'll be sure to remind the team and the appointment line of our direct access PT protocol.
Sounds good.
Active duty service members can make appointments for evaluation or treatment of musculoskeletal complaints through the appointment line. They can make acute or 24-hour appointments, follow-up or FTR appointments, and procedure or PROC appointments. A 24-hour appointment is the initial appointment booked for new onset musculoskeletal complaints with onset less than 14 days. Appointing agents use a protocol for the proper screening and appointing for a new musculoskeletal complaint. An FTR appointment is a follow-up appointment requested by the physical therapist for follow-up, reevaluation, or further treatment. A PROC appointment is a scheduled appointment with enlisted, civilian, or contract PT technicians or equivalent providers as approved or directed by the physical therapist. Scheduling templates should be managed to provide adequate, direct access to active duty service members within the capability of the physical therapy clinic. The clinic's historical demand should be taken into account in anticipating and meeting the acute access needs of active duty service members. Care should be taken not to displace referral appointments normally seen in the MTF to the network. The goals of this initiative are to allow physical therapists to maximize their care capabilities and to improve patient access to same-day primary physical therapy care. MTFs with the capacity may include the provision of direct access care to family members of active duty patients.
Open access is important specifically to active duty members because the requirements of the job can be quite extensive.
Kind of just a lot of our duties and a lot of our trainings lead to a lot of these small overuse injuries and small orthopedic injuries.
The majority of the patients that we had were not educated on that you can walk into a physical therapy and have treatment done.
It's a very good benefit to have the walk-in available for physical therapy. A lot of the jobs in the Air Force are very physical, so beyond just being ready for your PT test, you want to be ready for your daily job.
So we see post-operative, active duty. We see anybody with injuries, chronic, acute injuries.
If they are hurt or physically unable to do something, then they may not be able to go back to duty. So if they're seen by physical therapy, they can rehabilitate them and allow them to get back to their job.
If they call us stating that they have an injury or something ongoing pain, and they are active duty, then we have an algorithm that we follow, and we just ask them those particular questions, and if they fall within that criteria, then we go ahead and book them directly with physical therapy.
And it's important that they can get in at a time that works for their schedule.
So being able to get them in immediately and get them back to good health means better support for the mission.
Well, I played basketball this weekend and my foot's been hurting ever since.
Okay, Sergeant Irving, I need to ask you a series of questions to make sure you get seen in the appropriate clinic. We want to make sure you're getting the most effective and efficient care.
Okay, sounds good.
I just want to confirm that you are active duty, correct?
Yes, that's correct.
Are you experiencing pain anywhere else besides your foot?
No, ma'am.
Any cuts, scrapes, rash, other skin condition around the injury?
Nope.
And you said the pain started just a couple days ago after playing basketball, and this is the first time you've experienced this kind of pain?
That's right.
Are you able to walk on your own?
Yes, it's a little tender, but I can walk.
Okay, Sergeant Irving, based on our protocol, I'm going to go ahead and book you directly with our physical therapist. Are you able to come in tomorrow at 0900?
Yes, ma'am.
Okay, we'll see you then. Have a great afternoon.
Yes, thank you so much.
The protocol to determine whether a patient qualifies for direct access care is relatively simple. The first question to ask is whether the patient is active duty. Patients who are not active duty need to book an appointment with their PCM first, but any active duty service member can book appointments directly with physical therapy. The next question to ask is what the patient complaint is. Complaints of muscle or joint pain in the shoulder, arm, hand, hip, leg, foot, back, or neck qualify for direct access physical therapy care. However, if the patient also reports pain in the head, chest, abdomen, or groin, or if they have a cut, scrape, infection, laceration, abrasion, open wound, rash, or skin condition at the injury site, they must see their PCM first. Patients who have any other medical conditions or prescription refills that require attention should also book their appointment with their PCM. Likewise, if a patient is pregnant, they will need to see their PCM. The next question to ask is when the injury occurred. If the injury is less than 14 days old or the complaint is a new problem, the patient qualifies for direct access care. However, a patient with some specific injuries, such as those due to a recent car accident, should be booked with their PCM. Patients should also be able to walk on their own. Otherwise, they will need to see their PCM before being referred to physical therapy. The PCMH model promotes the full utilization of all healthcare team members to most effectively meet patient needs. As musculoskeletal examination and treatment experts, physical therapists are optimally poised to enhance the efficiency and effectiveness of the PCMH team in improving patient clinical outcomes while lowering total healthcare costs. Direct Access PT enhances access and the provision of quality, safe, patient-centered care.